Good evening, everybody, and welcome to the Alzheimer's Society's exhibitor booth. My name is Katie Hoy, and I am the Provincial Coordinator for Advocacy and Public Policy with the Society. So today we're going to have a very quick look at what self-advocacy means and what some key skills that can help you successfully advocate when you need to are. So first, let's start with the first slide. What is self-advocacy? So self-advocacy refers to the actions that you can take to improve a situation for yourself or for somebody that you're caring for. So when faced with a challenge, you self-advocate to find a solution to the problem. Often an advocate's job is to communicate with a variety of different people, and sometimes this doesn't really come naturally to us, and that's okay. I strongly believe that there are three key skills that, when applied to any challenge, significantly increase the chances of clarification, understanding, and hopefully success. At the Society, we usually speak about self-advocacy as it relates to the healthcare system, but today we're going to explore these tips with a more simple, straightforward example, just so that you can see how they can really be applied to any challenge that you come up against. So let's say for today, you've recently gone away on a trip and you've stayed at a hotel. And when you've returned home, you notice that your bank account was actually charged twice by the hotel. Okay, so this is the challenge that we're going to face today. So an advocate's key skills. The first is being proactive. So this is the first thing you need to do here, and that's to take control of the situation by figuring out what it is you need to do to resolve it. It's always a good idea to start by outlining your own measure of success. So in the situation with the hotel overcharging you, you could decide that your measure of success is a refund. That's all you need. If you do find yourself requesting a refund and, say, another free trip for you and your friends, maybe that's when you take a moment to yourself to manage your own expectations and ensure that what you're working towards and advocating for is realistic and achievable. This will help you succeed. Being proactive also means knowing where you can find further information to help you advocate. So the hotel you stayed at most likely has a website that you can visit, and that way you can find out the exact price that you should have been charged based on your trip. And having this piece of information is important because it helps you prove your case. So this leads on really nicely to the second key skill, which is keeping good records. Almost every time that you advocate for yourself, you'll be asked to prove why you need something. And it's up to you to present a strong case. If you've been keeping good records of dates, times, and incidences, you can illustrate your point effectively. So if you're sending emails and you're making phone calls, take note of the date, the time, and who you spoke to. That way, if you need to call back, you can request that you speak to the same person because you jotted down their name. In the case of the hotel, your records or your proof would be your bank statement, for example, referencing the date, time, and the charges that you saw that were incorrect. So make sure that you have that little piece of your bank statement easily accessible, and that way you can use it to illustrate your point. Finally, the third key skill is asserting yourself clearly and respectfully. So when you're asking for what you need, be clear. Stick to the point and don't allow yourself to be distracted or ramble on. Also, try and remove the emotion from the situation. So that anger or frustration that you're feeling about the inconvenience. Maybe take a moment to yourself to get in the right headspace before making a phone call that you know is going to be difficult or going into a meeting that you know is going to also be difficult. If you enter with a solution-focused mindset, it's more likely people will be willing to help you. Now, this also doesn't mean being a doormat and letting people walk all over you. Remember that it is perfectly okay to respectfully disagree. So now let's go back to our example. You're writing an email to the hotel and you tell them that you've been overcharged and you're attaching that bit of your bank statement to prove the fact. You request a refund and you also request that someone calls you to confirm that this refund is being processed. You've stated these requests in the email, so it's very clear what you deem as a solution and how the hotel can respond. Hopefully, you get a positive response. You may even get a voucher or an apology for the inconvenience. If you do not receive a response, call within a few days and check in on your complaint, and then go back and repeat these steps as necessary until you come to a solution. Often, self-advocacy requires persistence. So today we chose a really straightforward challenge, but I do hope that by looking at the skills here presented on your screen, you can see how they can be applied to even the most complex of challenges and still boost your chances of success. In the context of dementia, we apply these challenges to the healthcare system. So, for example, if somebody was having difficulty getting a formal diagnosis of dementia, they can use these skills by being proactive and connecting with the society and using some of our resources. They can keep good records of the symptoms that they're experiencing, the dates, the times, the concerns, and then at their next doctor appointment, they can assert themselves clearly and respectfully, and hopefully the doctor will then take their concerns seriously. So today was just a really quick overview of some of our advocacy tips, and if you're interested in learning more, a link to this full presentation will be available in the newsletter provided after this event. It's also available on the Alzheimer's Society of BC's website and our YouTube channel. For any questions or concerns about dementia, you can always call our First Link Dementia helpline on 1-800-936-6033, Monday to Friday, 9 a.m. to 8 p.m. But for now, that's all from me. Thank you for having me and enjoy your evening. Goodbye.